How do past experiences influence current sexuality? What is meant by simulated orgasm, and what are its implications in the relationship? Hello to all lovers of psychology and sexuality. Today, we will unveil the sexual curiosities of women. If you are interested in these topics, make sure to subscribe and activate the notification bell to not miss our future videos. Also, leave us comments and share your experiences in the section below. Let's get started. Past experiences can impact current sexuality. Positive experiences contribute to confidence, while negative ones can generate anxiety. Open communication and empathy are key to managing these impacts in intimate relationships. Simulated orgasm is when a person pretends to have an orgasm without actually experiencing it. The implications in the relationship can be negative, as it can lead to misunderstandings and lack of honesty. Simulation may prevent couples from addressing real sexual issues, hindering open communication and sexual experience improvement. The influence of the moon. Some people believe that the moon's phase can influence libido and sexual behavior. Although lacking solid scientific evidence, this belief persists in some cultures. The phenomenon of differential sexual desire. Some couples experience differences in sexual desire, where one member has a higher sexual desire than the other. Managing these differences in a respectful and understanding manner is important for maintaining a healthy relationship. The power of eroticism in creativity. Eroticism is not limited to sexual activity. It can also fuel artistic and literary creativity. Many artists have found inspiration in sexual themes to create meaningful and expressive works. The psychology of sex. Psychology plays a fundamental role in sexual experience. Factors such as self-esteem, confidence, and stress can influence desire and sexual performance. Sexual therapy can be a valuable tool to address these issues. The relationship between sex and mental health. Mental health and sexuality are interconnected. Having a healthy sex life can contribute to better emotional well-being and reduce anxiety and depression. The role of female pleasure. For a long time, female sexual pleasure has been overlooked or minimized compared to male pleasure. However, recognizing and valuing female pleasure is essential for equitable and satisfying sexuality for all individuals. The science of kissing. Kissing is not only a display of affection, but also involves a complex chemical interaction. Kisses can increase the release of hormones related to bonding and pleasure. Therapeutic benefits. Sex toys are often used in sex therapy to help individuals overcome sexual dysfunction, improve intimacy in relationships, and safely explore their sexuality with consent. Time of day. Women's preferences for sexual positions may vary depending on the time of day, with some feeling more energized and adventurous in the morning, while others prefer the intimacy of nighttime encounters. Toys for all orientations. Sex toys are available for people of all sexual orientations and genders. From toys specifically designed for gay men to options for non-binary individuals, there is a wide variety of products to meet diverse needs. Toys for female ejaculation. Some sex toys are designed to help women experience female ejaculation, also known as squirting, by stimulating internal erogenous zones and promoting the release of fluid during orgasm. Toys for sexual rehabilitation. Sex toys are sometimes used in sexual rehabilitation programs to help individuals regain sensation and sexual function after injuries or surgeries. Toys with shock components. Some sex toys are equipped with electrical components to provide tingling sensations, pulsations, or small electric shocks, known as erotic electrostimulation. Treatments. There are several treatment approaches for premature ejaculation, ranging from psychological therapies and ejaculation control techniques to medications and desensitizing topical creams. In Arab countries like Tunisia and Morocco, sex education may be controversial due to tensions between religious and Western values, making it difficult to implement comprehensive programs in schools. Types of orgasm. Women can experience different types of orgasms, including clitoral, vaginal, and G-spot orgasms. Some women also experience combined orgasms involving multiple areas of stimulation. Underlying disorders. In some cases, premature ejaculation may be related to underlying disorders, such as depression, generalized anxiety, or erectile dysfunction. Uniform fetishism. This fetish involves sexual attraction to people wearing uniforms, such as military, nurse, police uniforms, etc. Unusual fetishes. Fetishes can vary widely, and some individuals have unusual sexual interests. This may include an attraction to objects, specific roles, or unique situations. Use of ambient music. Soft and sensual music can create an erotic atmosphere during foreplay, setting the tone for intimacy and emotional connection between partners. Used underwear fetishism. Some people experience sexual arousal by smelling, touching, or wearing underwear used by another person. This fetish may be related to attraction to body odor or the intimacy associated with the garment. Variability. Similar to women, the experience of orgasm is highly variable in men. What triggers intense or satisfying orgasms can vary from person to person. Variability in preferences. Masturbation preferences and techniques can vary widely among women, and what works for one may not be effective for another. It's important to experiment and discover what feels best for each individual. Variable times. The duration of orgasms in men can vary widely, from a few seconds to over a minute. Shorter and less intense orgasms are also possible. Variation in speed and rhythm. Women's preferences for speed and rhythm during sexual activity can vary, from fast and energetic positions to softer, slower ones, depending on their mood and level of arousal. Varied symptoms. STDs can present a wide range of symptoms, ranging from abnormal discharge, painful urination, genital ulcers, to more general symptoms such as fever, fatigue, and muscle pain. Variety of forms. Open relationships can take many different forms, from couples allowing sexual encounters with other people to polyamorous groups, where multiple individuals are romantically and sexually involved. Versatility in relationships. The Kama Sutra is not limited to heterosexuality, but also offers guidance for same-sex couples and individuals with diverse gender identities, making it an inclusive guide to sexual diversity. Vertical transmission. Some STDs, such as HIV and syphilis, can be transmitted from mother to child during pregnancy, childbirth, or breastfeeding, known as vertical transmission. Virginity. The perception of virginity and its importance varies widely depending on culture and time. In some places, it is highly valued, while in others, it is considered less relevant. Virtual reality and pornography. Virtual reality is increasingly being used in the pornography industry, offering immersive experiences that allow users to interact with content more realistically. Virtual reality toys. Virtual reality technology has led to the creation of sex toys that can be synchronized with virtual experiences, allowing users to interact with erotic content in a more immersive way. Human sexuality is a fascinating and diverse field that never ceases to amaze us. Sexual curiosities unveil the wonderful complexity of the human experience in the intimate realm. As we explore and understand these facts, it is crucial to remember that each individual is unique in their sexual experience. Respecting and communicating with your partner are the keys to a satisfying and healthy sexual life. Sexual education and understanding are essential tools for fully embracing our sexuality.